Okay, hi, my name is Wendy Steffes. We're going to be doing a neuro assessment today on my patient Morgan and running through everything that is involved with a neuro assessment. So when Morgan walked in today, I was doing just a general preview of how she was walking, what her movement was her gait, just making those general observations while she was walking in to start my neuro assessment on her. We're going to go over level of consciousness, and by doing that, I'm going to ask you your name and your phone number. So, what is your name?
Morgan.
And what is your phone number?
801-783-6763.
Perfect. So I'm observing her as she's doing that. I'm observing her posture as she's talking and her body movements as well. I'm going to also observe her speech, the way she's saying this, and then also observe her behavior and her appearance. And is she clean? Are her clothes well kept? Like, is there something that I should be concerned with? What is her attire looking like as well? I'm also going to observe her mood and her feeling and her expression. And by doing that, is she relaxed? Does she seem tense? Does she seem anxious? Is she twitching at all or making any kind of involuntary movements? In doing this as well, I'm going to ask her, how are you feeling today?
Good.
Okay, perfect. And then also when a client is talking, I'm going to observe their speech, their eye contact with me, and their overall affect. I am going to assess her thought and her process and her perceptions. And by doing that, I am going to ask her basically, what is her understanding of her health today? Like, do you have an understanding of why you're here today?
Just for physical.
Perfect. So cognitively, I'm just going to be listening to her and how she talks to me and just basically assess like where she is cognitively. All right, so now we're going to check for cranial nerves. The first cranial nerve is the olfactory nerve, and that is basically her sense of smell. And so Morgan, I need you to close your eyes and also pinch one side of your nostril. And then I just want you to smell this. Do you smell something?
Mm-hmm.
Okay, perfect. What would you say that is?
Perfume.
Perfect, that's wonderful. Okay, so the second cranial nerve that we're going to be checking is her optic nerve, and that is basically her eyes. So at this point, I would have had an ophthalmoscope. I have a hard time saying that, I'm sorry, but I do not have that tool, so I am basically going to use my light to pretend. What I need you to do, Morgan, is basically cover one eye. I'm just going to look into your eye, and I just want to look at her red reflex, okay? And then cover the other eye. And then I'm also looking at her optic disc as well. All right, so everything looks good there. I'm also, when I was looking at her eye, I was assessing each eye just for the normal movement, for confrontation, just to see like if her pupils are going in and out as well. And I viewed the retina as well as the optic disc of each nerve. So we're going to move on to the cranial nerves 3, 4, and 6, which are your ocular motor, your ocular motor, and then your trochlear and your abducens. All right. What I'm going to do is I'm going to use my light again. So I'm starting to shine the light in you, but I want you to close your eyes. I'm just observing her eyelids. I want to make sure that they are symmetrical, and then open your eyes. And she has good movement with her eyelids as well, so there's no drooping in her eyelids. What I want you to do, I'm going to turn the light off. I want you to follow my finger. So I'm basically going to do the 6 degrees of movement. Okay, so I just want you to follow my finger. And while I am doing that, I am watching her and observing her eye movement and making sure that she has a smooth eye movement, that her eyes are coordinated, that there's no drooping, and that they are strong in their movement. There's nothing lagging as well. I'm going to assess her pupillary reflex to light. So I'm going to use the light again, and I'm going to use a direct light looking directly into her eye, and then also looking from the side of her eyes as well. So I just want to make sure when I come into that range that our eyes have good coordination and movement, and that there's nothing off with that. All right, we're going to move on to cranial nerve number 5, which is the trigeminal nerve. And what we're going to do is we're going to be testing for motor function. So I'm going to test the strength of her jaw. So Morgan, I want you to clench your jaw and basically clench your teeth. And then I want you to move your jaw side to side, okay? So that I could feel it. Okay, perfect. So her movements she has good range of motion, they're not jerky at all, and they're moving very smoothly. It's not walking or popping at all. Okay, next thing we're gonna do is I'm going to have you close your eyes and I'm gonna test for sensory. So I'm going to be touching your forehead, your cheeks, and your chin, and I'm going to have you tell me if it's a dull feeling or a sharp feeling. Okay, so I'm gonna touch your forehead right now. Is that dull?
Dull, yeah.
Okay, and then your cheek?
Dull.
And then your chin as well.
Dull.
Okay, perfect. So she's feeling exactly what I want her to feel with her trigeminal nerve. All right, so now we're going to assess for your facial nerves. And by doing that, I'm going to test the movements of your face. So I need you to smile. I need you to frown. Okay. I need you to wrinkle your forehead. I need you to puff out your cheeks like this. Okay. And then I need you to show me your teeth. All right, perfect. And then purse your lips. So all of her movements were well coordinated. They were strong. There wasn't any drooping, and they were symmetrical as well. So everything looks good in that area. Oh, there's one thing that I did forget with that. I need you to close your eyes tightly so that I could just assess for that. Perfect. All right, wonderful, Morgan. All right, so now we're going to test cranial nerve number 8, which is the acoustic nerve or the vestibular cochlear nerve. And I'm going to be using a tuning fork for that, okay? And this tuning fork just is going to sense vibration, all right? So at first I'm going to check your hearing ability. And so what I'm going to do is I am going to strike this and put it on your forehead, and I just want you to tell me what you hear, or if you hear anything, okay? Vibration where?
In ears.
In both ears?
Uh-huh.
Okay, perfect. All right, now I'm going to strike this again. I'm going to put it behind your ears and then move it around to the side, and I just want you to tell me if you feel that and then also if you hear that.
Yeah, I can feel it. Yep, I can
Here?
hear it.
Okay, and let's do it again over here. And be careful to hold it properly.
Yeah, I can feel it. Oh, I can hear it.
And you can hear it. Okay, wonderful. Then her hearing ability is proficient, and she doesn't have any hearing loss. All right, so now what we're going to do is we're going to test a whisper test. So that's fine hearing. And I'm just going to whisper a 2-syllable word into each ear, and I just want you to tell me what that word is, okay? So this ear first,
Apple.
and then this ear.
Baseball.
Perfect. All right, we're going to move on to the Weber test. And basically what I'm going to do at that point, oh, I'm sorry, I already performed the Weber test. That was on your forehead, so I apologize. I'm moving ahead of myself. All right, let's go on to the Rhine test. Well, I apologize for that too, because we did that as well. So we already performed the Weber test and the Rhine test. The Weber test was the tuning fork on the forehead, and the Rhine test was behind the ears and in front of the ears. So she doesn't have any deficiencies with that. All right, let's move on to your cranial nerves 9 and 10, and that is your glossopharyngeal and your vagus nerve. I'll be using a light and a tongue depressor with that. I'm going to check your motor skills. I'm going to be looking inside your mouth. I'm going to have you swallow, and then I'm also going to look at your uvula and your soft palate and your hard palate as well. Okay, do you feel comfortable with that?
Yeah.
Okay. All right, so I'm going to use this tongue depressor and this light, and I just want you to stick out your tongue and say ah to me. Okay, so I'm going to be looking in the back of her mouth. Can you open just a little wider? And then I see her uvula. It is midline, and it looks strong, and it moves up and down. And then I'm also going to check her soft palate and her hard palate as well. And that looks just fine. I could test her gag reflex, but I don't want her to vomit on me. And so I know that she has a strong gag reflex, and I would rather not do that at this time. Okay, so we have passed that and everything looks strong there. All right, let's move on to cranial nerve number 11, which is your spinal accessory nerve. And that is going to test for strength in your spine. Okay, so what I'm going to have you do is I'm going to have you shrug your shoulders up, and I'm going to try to push down, and I want you to resist that. And I'm just going to test for strength. So she does have good motor strength here. I don't see any lagging on either side. She's not drooping at all, and she has very, very good strength with that. Okay, and it's symmetrical as well. Moving on to cranial nerve number 12 is your hypoglossal. I'm going to use the tongue oppressor again, and I'm going to test your tongue strength. And what I'm going to do is I'm going to put this on each side of your tongue, and I just need you to push a little bit of resistance on each side, okay? So go ahead and open your mouth and stick out your tongue. And then just resist on that side, and then resist on that side. Perfect. So she has symmetrical tongue, her tongue is symmetrical as well as it is strong in her motor skills with that. All right, so that concludes our cranial nerve assessment. Now we're going to move on to test your strength and your movement of your muscles, all right? By doing that, it is going to be testing your cerebral system, so your motor and your cerebral systems. I'm going to assess your gait. So I'm looking at you right now and just kind of seeing how you're sitting, but what I would like you to do is basically stand up, okay? And I'm going to look at her gait and just make sure that she has good posture, that she's standing straight. I'm going to look for any tics that she may have, any drooping, make sure that her shoulders are in line and that they are symmetrical as well. She has good balance. She's not like falling. And then I'm going to have you walk across the room and I'm going to see how she walks and what her motion is at this point, okay? So I'm going to step to the side. And Morgan, what I would like you to do is I just need you to walk to the closet doors and then walk back. And while she's walking, I'm watching her movement, I'm watching her range of motion, and I'm making sure that she has good balance and that she is also walking in a straight line. Now I would like for you to put your heel to your toe and do the exact same thing. So I'm just going to test her movement there, make sure that she has good coordination, she has good balance, she has good strength as she is walking. All right, and then return. Perfect. Okay, Morgan, you look like a very strong, well-stable girl. That's wonderful. Okay, let's move on to the next section of this assessment, and that is the Romberg test. So I basically need you to stand erect, so stand straight with your hands to your side and your feet together. Is she swaying at all? That's what I'm assessing. I'm looking at her gait. Like, are there any involuntary range of, or any involuntary motions that I'm noticing as she's standing here straight? Now I need you to bend your knee and stand on one foot and do that on each side, okay? She has good balance and good coordination. Now, if you will, play a little game for me and hop on one foot. I just want to see if she is able to do that. Good. And so she has strength in her legs as well. All right. So we are going to do a little bit of coordination. And so I'm going to have you sit back down on the bed here. And just kind of hang your feet off. All right. So what we're going to do first is I'm going to have you touch your finger to your nose. And I'm just going to see if you could do that and how coordinated you are. So while she's doing this, I am looking at her range of motion. I'm also looking at her coordination. Is it a smooth voluntary movement or is she jerky at all? She has very good smooth movement, so she is doing that very well. Now what I'm going to have you do is I'm going to have you slap your hands on your leg, okay? And so I'm going to test for your coordination as well and see how easy you move this and if you're coordinated when you do this activity. Perfect. Very smooth, very coordinated, not jerky at all. All right, Morgan, what I'm going to have you do now is lay down, okay? We're going to test the bottom half of your body. And what I want you to do is take your heel and run it along your leg, your opposite leg, to your knee. And do that on both sides. Okay? Very smooth, easy, coordinated movements. Perfect. You did great. All right, Morgan, I'm going to have you sit up now. And we're going to test your sensory. Okay? And by doing that, first what we're going to do is, this test is going to be performed with your eyes closed, so you can open them in between, but we're going to test for vibration. I am going to use the tuning fork again. I'm going to put it on different points of your body, and I just want you to tell me exactly where you feel it, okay? Okay.
My forehead.
Okay.
My arm.
Okay.
My leg.
Okay.
My foot.
Perfect. Okay, so she is feeling adequate vibration in most areas of her body that I checked. Now I'm going to check for light touch. So I'm just going to lightly touch you with a tissue, and I want you to tell me where it is. So close your eyes.
My forehead. My cheek. My finger. My leg. My toe.
Okay, so she's coordinated in all of her light sensation as well, and there is no delay or deficit there. Now what we're going to do is what's called point localization. So basically I am going to point to different places on your body, and I want you to tell me where I'm pointing to, okay?
My forehead.
Okay, close your eyes though.
My cheek.
Okay.
My arm.
Okay.
My knee. My leg.
Wonderful. All right, I'm also going to test to see if you know what kind of object I'm putting in your hand, where you could feel something. So open your palms, okay? I'm going to put this in your hand, and what does that feel like?
A chopstick.
Wonderful. So she was able to identify an object in her hand when placed in there. All right, now what I'm going to do is what's called graphithesis. And basically I'm going to draw in the palm of your hand a number. I'll just do it on one side. And I just need you to tell me what number that is, okay? Where's my pen? Here it is. Okay.
3.
Let's just check the other one.
3.
Perfect. Okay, so she is able to distinguish a number when I draw that in her hand. All right, let's move on to the conclusion of this assessment, and these are your deep tendon reflexes and your superficial reflexes, okay? So if you wouldn't mind, just so that I can get in here, I need you to scoot down just a titch. I am going to take my hammer, and we are going to check your bicep first, okay? So basically, I would have her relax her arm. All right, relax your arm. I'm going to feel for that tendon, and then I am going to strike the hammer on that, and she should raise her arm. And so her bicep reflex is intact, all right? I'm going to check your brachioradialis, all right? Perfect. And then now I'm going to check your tricep. This one's a little bit harder to do, so I need you to relax and just relax your arm here. Perfect. Her reflex, she moved her arm out, so I know that that reflex in her tricep is intact as well. All right, let's do your patellar. This one's always a difficult one for me. Just relax your legs. So I just want you to hang down here. And then basically her foot popped up, so that patellar reflex is intact as well. Now I want to check your ankle. So I just want you to relax here, okay, your ankle. And then basically I'm checking for her reflex there, and that is intact as well. I'm going to check for her, I apologize, that was her Achilles, not her ankle. So we're going to check for what's called an ankle clonus. And by doing that, we used to do this in labor and delivery all the time. We would check for clonus. And if she had hard twitchy movements, then she was positive for clonus, and we were concerned about possible hypertension or preeclampsia at this point. But I'm just going to do a range here and then push back, and her foot flaps down, so she doesn't have any positive clonus there. If she did have a positive clonus, it would jerk back and forth like this, okay? So the last test we're going to check is your superficial reflex. I need you to lay down, and then I'm going to run this, and it may tickle if you have ticklish feet. I'm just going to run this along her foot right here, and her toes should span out, which they do, okay? So that means that her reflexes are intact in her plantar as well. So, all right, that concludes our neuro assessment for today. Thank you so much.